numbers we are just going actually. How many of them has got distinction, first mark, second mark, like just related to the numbers, we are back. But the real leadership is not brought here in the students.
Yes, sir.
There's a lot more. Decision making is most important. It needs to be inculcated in the nursing education.
Okay, and
also
execution is important. And when we truly mentor them, maybe it will come into them, because without perfect mentorship or preceptorship, students are lacking in their practice.
Because problem solving skills, communication,
yes,
these are the basic skills needs to be developed to see the reality actually in the clinical practices.
Yes, sir. Thank you.
Yeah. Let me add certain thing. Actually, for any program development, I feel the measurement is very important. The evaluation, that is the examination, which is the one, will differentiate higher achiever, lower achiever, or average student. But our question papers, many of the universities, question papers are same for the BSc nursing and MSc nursing. For example, at the BSc level, they will ask write in detail about schizophrenia, nursing management. Same question they are asking MSc program also. So what happens, we are not differentiating practitioner nurse or beginner nurse. When the evaluation tool is not changing, the rote memorization, just knowledge things will not improve. Case scenario based things. We are very happy that 2021 Indian Nursing Council revised syllabus is included ASCII, simulation techniques and multiple choice questions. It made a structure that these many long essays and these many multiple choice questions, at least most of the universities has changed, it is differentiating. So what is happening now, why people are going for the part-time in PC, BSc and MSc nursing, they know that even with BSc knowledge, they can clear the MSc program. So for that reason, if the evaluation system is very strict, they would have not cleared their part-time MSc nursing program. So there is no question of part-time at all. Everybody is clearing. The person who is 2 years continuously coming to the classes also, he will clear definitely. The person who reads only for a month and he is also clearing. So we are lacking problem with the evaluation. That need to be changed.
Yes, thank you. Yes, sir.
I would like to add here, I agree with Dr. Shrivani madam, and I would go with Dr. Judy madam, because we are doing OSCE in Gulf countries, because to evaluate their practical perspective, definitely it is not possible the way of evaluation what we are doing. I hope even 20-25 years also we have not changed. So I feel this is a high time if we could change evaluating towards practical oriented OSCE, not only OSCE, even multiple choice questions also we can formulate as a case scenario based. At least during that time we can prepare the future nursing graduates for better practicing world.
Yes, yes, sir. Yeah.
Thank you.
Thank you so much, sir. And for this round one, I have last question to Dr. Nageshwar. If you are a HR manager sitting here for the placement of our graduates, what would have been the complaint about the fresh nursing graduates that they are lacking in these are the competencies? What you feel?
This is again, thank you madam, again it's a continuation to the questions like earlier questions. Definitely I will not ask theoretical questions. No theory. What is diabetes? No, I will not ask this question. Now, what are all the clinical symptoms? No, I will not ask these questions. Now, I'll ask if you come across a patient who is having a diabetes along with hypertension. So you will not study this in the textbook. Trust me, no textbook will give you if a patient with diabetes and hypertension, how to take care. That will come with only practice. I hope my colleagues will agree. Yeah. So when you really have worked in such environments, by God forbid, we are getting an opportunity to work in such environments in really, virtually we are getting it here. So if we are working in such environments, definitely we are going to answer. And one more thing, yeah, we have a lot of knowledge. Knowledge is easy today. Gen Z is getting a knowledge. But the problem is values. Dr. Smriti madam was telling ethics, moral values, responsibility. Are we accepting the responsibility? Yes, I have done a mistake. Yes, I am a human being. Of course, I am an expert, but I have done a mistake. Yes, this is my mistake. I accept. So acceptance, responsibility, ethics, moral values. If you have knowledge, it's okay. But are we having all these values to inculcate in the practice? So these are all the things, etiquettes, which we are going to check as a HR person.
From the fresh
Thank you.
graduates. Yes, thank you, sir. Thank you so much. So at the end of this reality check round, I think we have unanimously agreed that yes, of course, we are trying hard to inculcate the values, the leadership into the students, but there are some gap between the theory and practice. Okay, so next round we will move into that how technology and innovation can bridge this gap. So with this consequence, I have the first question to Dr. Judy ma'am. As you have a very versatile experience from Western countries and then European countries, American and Oman and India. So ma'am, what one practice from your own experience in nursing education that you wish that every nursing college would adopt?
As I did in my presentation, I strongly advocate for simulation and interprofessional collaborative practice. These are the things which are really not integrated completely in our Indian scenario. We are integrating in India, but it is not extensively integrated, I believe. So if you integrate simulation and interprofessional collaborative practice during education in all our clinical courses, as well as they should be taught interprofessional education, interprofessional collaborative practice through simulation, and direct interprofessional collaborative practice in the hospital. This will really bridge the gap and improve patient care. This is what is my opinion. Thank you.
So madam has suggested that simulation and interprofessional collaboration is the key to success that every institute would adopt. Thank you, ma'am. Now I would ask Dr. I. Clement, sir. Sir, we want to know that one teaching innovation at your institution, what you would have followed, which genuinely changed that leadership-ready graduates.
Now it's 100% sure that what madam has said actually.
Yes.
Simulation-based.
Simulation.
It's most important. They can practice 100 times in simulation practice. But unless and until they are masters in that practice, skill.
They are not exposed in the real scenario. Yes.
So definitely simulation training
is the
will
best
be helping.
option where
will
they
be the
can
option.
do mistake and learn, mistake and learn, mistake and learn and master.
But how
the
much
skill.
involvement the students are showing and the teacher is teaching is most important actually. Simulated based learning.
Yes.
And you should bring lot of leadership and initiation
Okay.
for the leader to explain and teach to the students.
Okay.
That's
Thank you
place.
so much, sir. Thank you. My next question to Nageshwar, sir. Sir, now we have AI, digital health, genomics, climate health, data literacy, etc. So, in the next 10 years, what is your institution teaching these and how? Integrating all this into your teaching curriculum.
See, of course, the question is very hypothetical. I mean, all are very important. I mean, AI is needed, genomics, data literacy, and climatic health. But for me, I feel data literacy is at the first pace because, see, we have a lot of data available today.
Yes.
But what data to trust is very important. Nowadays, you just give in Google or AI, you get a lot of data. But whether to believe it or not.
Yes.
Lot of researchers also we have. But which research to be trusted?
Trusted.
And which database we have to take the research for including it into the systematic review to generate evidence synthesis. So for me, data literacy is very important. Now, how that will come? That also again, if you want doing data searches, you will understand what data is correct. Rest also we need climate health and AI, all these things are also must, but they are next to the data literacy.
Yes, sir. And I think this data literacy you have mentioned in your presentation even,
Yes, of
that
course,
yes,
of course.
we should be very, very literate about our data, what authenticity the data we are getting, we should be very careful.
Yes,
Thank you, sir. My next question to Aurora ma'am, that what is the biggest barrier that stops AI and simulation-based learning from actually being used in our classroom in the present scenario?
I think there are 2-3 reasons. I think the first reason is the mindset of the people. If they really want to use, they will use it. You don't need lot of resources and money and push and infrastructure. For example, using a simple app, teaching through common case-based scenarios. Now a lot of these things are coming up like ChatGPT, Claude, which we were not knowing 5 or 6 months before. But now increasingly we are using. And it has become a necessity now. Because earlier, now, you'll be surprised to know that now all the MSc thesis, the students, they are just putting the research problem statement there, the whole thesis is coming out, and they don't know even the single sentence how to write in English, but the thesis is very beautiful. All the analysis, everything they are doing. Means it has become a necessity to use, it is affordable, it's easy, it saves time. Okay, we should use it, but we should be very careful. Again, the integrity, the plagiarism issues, all these things need to be kept in mind. And if you think that you cannot implement simulation in your college, that's something the management needs to be convinced of. As the leader, as a principal, you need to convince that you need these mid-fidelity mannequins, high-fidelity mannequins. If that much amount of money is not there, at least you can improvise things. You can have standardized patients. So if the vision is there, will is there, all the faculty are cooperative, the team wants to do something, they can do it.
Yes, ma'am. So I can understand that if technology is there with right mindset and right attitude, we can definitely implement that. Okay, and my next question to Dr. Shivani, ma'am. Ma'am, if you had the power to change one thing in nursing curriculum, starting tomorrow, add it, cut it, or redo it, what you would do?
Adding, of course, simulation-based teaching and interdisciplinary collaboration. So especially in the psychiatry, simulation is the toughest thing. Okay. So now we are developing for the Indian Nursing Council that case-based standardized patients, how to prepare. Then in the psychiatry, especially ASCII, what to be created. So these things will be definitely added. And informatics, AI technology, these things are required. Then to remove means more theoretical things. So recently I have participated in development of nurse practitioner course, residency program for Indian Nursing Council. I have developed curriculum. Then diploma in psychiatric nursing also. There lot of importance is given to the practical than to the theory orientation. So I feel these kind of things are more important at the MSc level. Residency program creation is the best method so that the practical skills will be learned. And I feel that what to be included can be given permission to such colleges MSc program where they have a attached minimum 100 bedded hospital. So when these things are there, interdisciplinary collaboration will come and definitely hands-on training. And that institution has to provide stipend to the student. Unless until stipend is not there, people are not coming forward for the master education and it will go with the distance program. So that whatever curriculum, however it is there, when it is not reaching to the consumer or to the students, it is not much useful. So that is adding things are clinical oriented things, and most of the things like a internship program or otherwise like means where they can work that a residency program type. There is a MD program is there, MS program is there. They do not have a yearly once examination. At the end of MD completion only, 3 years continuously they will be there with the patient and learning. Why can't we do that system in the MSc nursing in the clinical oriented where the college or institution will give the stipend so that the student will be placed full time in the hospital setting. So that is for adding, removing theoretical things.
Okay, thank you, ma'am. So at the end of this round 2, we have already seen how technology and innovation can bridge the gap. In connection with Dr. Shivani ma'am's question, I would ask Dr. I. Clement that now healthcare is getting more global and more diverse. So what real change in the nursing curriculum we need right now to make our students be a leader?
It's a good
Only
question.
leader.
We need to integrate the curriculum actually. Integrate the cultural competencies.
Yes.
And also like global health issues needs to be in our curriculum, nursing curriculum. So when we do this, there will be we can see the significant changes.
Changes in the students. Thank you, sir. Thank you. Dr. Reddy, from your vast practical experience, can you give us 2 examples where you have seen students who are really leader, they are like behaving like a leader, or you have seen some students who are struggling to be a leader? The fresh graduates, when you are seeing them in the real scenario.
Yeah, actually, see, it's something like which we have to observe as a teacher. In the classroom itself, we can observe some students will take initiative, lead the groups. And some students are somewhat, they wanted to take an initiative, but they lack of skills. I've seen these scenarios even in the hospitals, how it will happen if they are not able to take care of a patient. At least they should be in a position to inform the senior nurse, senior staff nurse. We can call it as a leadership quality also, because they are at time they are reacting. But you know, even sometimes some students, I have observed some students, they don't know anything, they can't do anything, but they could not even inform. It's an emergency condition, but they could not inform the senior staff. But that kind of situations will put everybody into the trouble. So scenarios are like leadership, we can understand, like when the students are taking initiative, definitely they will lead. Of course, leadership is not about only, you know, taking all the group along with us. It's a sense of responsibility. And at least when we could not able to do it, at least we are handing over the responsibility to others who are in well-known.
In that
like
position.
In that position.
Yes. In this same connection, I would ask Aurora ma'am. Ma'am, do you feel that leadership actually be taught in the classroom, or is it something nurses only pick up through experience?
I think leadership both, it can be taught also and it can be picked up with experience, both things also. See, the theoretical component of the leadership, we can teach them in the class. But to instill the skill part, that can be taught to them through when we organize different types of workshops, when we give them some group projects, right? So there we can see who is the student who has the most potential to become a good leader.
Group leader.
Who
yes.
is actively working, who is problem solving day to day.
Yes.
Isn't it? If suppose it is a 5-day workshop, 3-day workshop, they very actively, they will do all the work. At that time you can, you can sense, you can have a good, instill these type of skills in them. Similarly, you can give them simulation-based exercises, that if this is the situation, now what you are going to do. And in the end, we can debrief them, that okay, this was the whole process, how you went through this, and at this step, this could have been done. So that's how slowly and slowly we can upgrade their skills, how to become a leader. And the second thing is, first though we are giving them some exercises to do. And then secondly, we ourselves have to behave in a good leader way, because they follow us. We are the role models for them.
Role modeling, yes.
Right? If we will do all unnecessary things in front of the students, what they will learn?
Yes.
So we have to be very careful, we have to be very humble, polite. We have to always have a good behavior in front of students.
Yes, ma'am. Role modeling is
Role
very, very
modeling,
important.
yeah.
Thank you, ma'am. My question to Dr. Judy, ma'am. Ma'am, as you have mentioned in your presentation that you have a simulation center. So if you want to recruit one nursing graduate in your simulation center, what are the leadership qualities you would look for?
First thing is passion.
Passion.
Because if a person does not have passion, he will not be able to take things in a positive way. Similarly, I would expect her or him to have a change mindset. Because if the people have resistance and do not want to change in simulation practice or whatever practice, they cannot bring significant changes. So I would say passion and change mindset is very much needed for a person to lead. That is what I feel. Thank you.
Yes, thank you, ma'am. So from the discussion, we understood that proper attitude and proper mindset, passion, we should have to be a good leader, and which can be started teaching from the classroom, and it can be nourished during the clinical experience and then reflection exercises. Okay, so from here we want to look ahead, maybe after 10 years, how the nursing education or nursing leaders look like. Okay, so Dr. Nageshwar sir, should nursing students be trained in policy advocacy, or how to influence the health policy? Is that outside the scope of nursing education?
No, it is not the outside the scope, because already policy advocacy is something which we are lacking. So, of course, students have to be taught with the policy advocacy. As Professor Smriti Arora madam said, they are asking why these days.
They are asking.
So that's a good thing, they are asking why. But if we are taking this thing and sensitively, if they take some things to at the policy level, obviously there will be some change. So definitely policy advocacy we have to teach to our
students to
yes.
bring some positive
Yes, of
changes
course,
into
definitely,
the system.
Definitely.
Okay. Dr. Shivani ma'am, as you are very, very expertise in the psychiatric nursing, so my question to you is, how do we actually build the teamwork and interpersonal professional collaboration into the nursing training?
Yes. This is already there in the psychiatry specialty. In 1998, I joined in NIMHANS as a first year MSc nursing student. It is not taught, actually, we have experienced. Students are, in that institution, students are posted in the unit posting, not in the psychiatric wards. In the unit, we have a psychiatrist, clinical psychologist, psychiatric social worker and psychiatric nurse. The same system I am following in our institution also. So it is like a group of multidisciplinary people will provide care to the student. Our MSc nursing students are not posted in the wards. They are with the multidisciplinary team. In that way, the collaboration will take place and they know what psychological interventions are given to the patient, psychiatric things, and also legal aspects, how the social work people are taking care. There is a collaboration is developed and the teamwork definitely improves the patient condition. So if at the MSc level, if these kind of practice is there in that particular hospital, definitely interdisciplinary collaboration definitely will take place.
Yeah, thank you ma'am. And Judy ma'am, as you are working outside, so you spoke about networking and everything. So what concrete one step we can adopt for this interprofessional collaborations between India and the foreign?
Yeah, thank you for that question. Actually, interprofessional education is the first step, I would say. Actually, we can have interprofessional education within the university or intra-university and international universities. So, for example, now there are online platforms where international faculty can teach medical nursing, allied health students together. So they will learn the best practices from international faculty and we can share the best practices from India to international students. So this way we can start. Then we can move on to simulation, interprofessional simulation. So after we train people through interprofessional simulation, they will be better trained to practice directly in the hospital as interprofessional teams. That's what is my suggestion.
Yes. Thank you, ma'am. Sir, Dr. Clement, sir, the audience is the future ready nurses who are sitting here. So what would be your honest advice to the nursing student who want to become a leader tomorrow? Not only a bedside nurse.
They should adopt and innovative.
Yes.
And they should be creative.
Creative. Adoptive, creative and innovative. Yes. Thank you so much, sir. Thank you. So after all this discussion, this is a quick round where I would ask a rapid fire round, and I ask my panelists to give only one sentence answer to this. First question to Judy ma'am. One word for 2025 nurse leader.
Invest in yourself.
Invest in yourself. Yeah, round of applause, please. Madam has also mentioned this in her session, okay? Dr. Nageshwar, Leadership begins with
Understanding yourself.
understand yourself, invest in yourself, okay? Dr. Clement, one outdated practice we should drop immediately.
Memorization, ma'am.
Memorization, yes. Dr. Arora, ma'am, AI in nursing education in one word.
In
Nursing education.
speed.
Speed. Okay. Dr. Shivani, ma'am, the one skill that every nursing graduate must master.
One skill,
One skill.
communication skills.
Communication and interpersonal skill. Thank you so much. Thank you so much, everyone. Okay. So we are moving towards the end of this panel discussion, and thank you, panelists, everyone, for your vision, wisdom, and your commitment towards changing the nursing profession, the education, and then making our graduates nurse leader. So I have few questions. We'll ask one question to one or two panelists, so that the audience can take the take-home message from that, and then we can implement in our nursing curriculum. Okay, Dr. Nageshwar, if we all meet again 10 years from now, what's the one change in nursing education that would prove that you would actually succeeded in building the future leader? What change you would like to observe in us, and which will make sure that yes, we are prepared.
Attitude of the students to learn to the current trends.
Right attitude.
Right
Right
attitude, yes,
attitude.
of
Students should showcase the right attitude towards learning.
Towards learning of current trends.
Current trends.
Current trends.
Thank you, sir. Okay, so we should be having correct attitude. Same question to Arora, ma'am. With right attitude, what else we would observe after 10 years, then we would say, yes, we are creating the future leaders.
If they are leading with honesty and integrity with updated knowledge.
Yes, honesty, integrity, right attitude. Dr. Judy, ma'am, in one sentence, what message would you leave with the nursing students across the country who want to become the leader?
Again, I would say invest in yourself, empower yourself, and increase the image of yourself. That will, you will stand out as a nursing professional without any low self-esteem. I want every nurse to feel empowered. Thank you.
Yes, the self-esteem has to be very high. We should not feel that nobody is appreciating us, nobody is recognizing us. We are very, very low recognized. No, we should have self-esteem always high. And I think this responsibility belongs to us only. We have to project ourselves in that position. Okay. Dr. Clement, sir, is every nurse educator in this room had to change just one thing starting from tomorrow, what it should be? Nurse educator.
Lead with knowledge.
Lead with knowledge.
Serve with compassion.
Serve with compassion.
Keep learning lifelong.
Oh, keep learning lifelong. Wow. Thank you so much, sir. The same question to Shivani, ma'am.
So one thing, so to start means I will regularly go to the clinical so that I will become a role model. I too will learn and students also will learn.
Yes.
Clinical things.
Thank you so much, ma'am. So I think we have got really take-home message from all our panelists that we have to be passionate, we have to have right attitude, we have to be very, very honest to our profession, we have to invest in ourselves so that keep our self-esteem very high. We should not be feeling low and then anything. And the tagline of today's panel discussion, what sir has said, Dr. Clement sir, I would request you to repeat again to the group.
Lead with knowledge.
Please groups, repeat after sir.
Lead with knowledge. Serve with compassion. Learn lifelong. Thank you.
Thank you so much, sir. And ma'am has said about the clinical expertise. So it is lifelong learning. The teacher and the students both are learning. It is lifelong. Sky is the limit. And there is no hesitation in learning from each other. We should be learning from each other at every step. And we should respect everyone in our profession. Thank you so much, all my panelists. And thank you, audience, for your patience listening. Now, if audience have any question to our panelists, we can take at least 1 to 2 questions. Anyone? Anyone from the audience? Yes, nursing faculty, esteemed faculty members, if you have anything to ask our expert speakers, panelists. Joshi sir. All have answered very nicely. Yes, thank you. Any student? Your practical challenge, what you are facing? If you have anything to ask, anyone? Yes, at the last. Organizer, we can take one last question at the back. Please give the mic. Last. Yes, you can come forward. Yeah, please come. Give the mic. Wait, it's okay. Yeah, tell me.
Good evening, sir. Good evening, ma'am. I am the student of Shree Krishna of the nursing Bhabhar. My
Come little closer.
Okay.
Yes. Go ahead.
my question, lead simple. I'm always confused. I how to
बेटा सामने आ जाओ सामने और थोड़ा सा
sir and ma'am, I'm always confused how to to close the gap between a theoretical knowledge and the practical knowledge, because only scenario based, if any questions or any situation arise, how to solve it as a nursing student and as a future nursing officer.
Okay, I think Dr. Nageshwar can answer this because he has addressed this in his session.
Yes, ma'am.
See, you take any profession, there is always a gap. Since we are into the nursing, we are identifying the gap. Of course, there is a gap, but my intention is, my recommendation is same again. Keep working. Go to the practice. Dr. Srivan also told, even now, madam is going to the clinical practice. So go to the clinical practice, keep working, keep learning, you will learn automatically. There is a gap. See, you cannot completely fill the gap. You can never.
Yes, sir.
I am hearing this gap since 20 also. And also there was a gap. And even future also there will be a gap. Right? So I cannot say 100% this gap will be filled. So you may be thinking I am pessimistic, but this is how life is. Nobody's life is perfect, no profession is perfect. There is a gap. But you go to the practice, you learn, try how much our best possible way to fill the gap. That's it.
Okay, sir.
Practically.
Yes, sir.
Everyday practice is important because practice only make you
excuse me.
perfect.
I just want to say in 3 words,
Yes.
learn, train, apply.
Yes, sir. Learn, train, and apply.
Can all of you say?
Yes. All of you group, please say.
Learn, train, apply. So, learn by knowledge and your cognitive skill, develop, train, and your attitude. Third one, you apply it in your practice.
Practice.
So, the gap will be filled.
Yes. Thank you so much. Thank you.
Yes, sir. Learning
Okay.
is always a lifelong process. So I am keep remember your
Words.
valuable words, and I'm
Thank you so much.
always
Thank
obliged.
you.
Thank you.
Yes. And this courage is very important to ask questions and then take the insights from the leaders, nursing leaders. Thank you so much. Thank you, panelists. And we are ending here our panel discussion. Thank you, audience.
Thank you for your wonderful panelists, for your thoughtful discussion and inspiring perspectives. We are truly grateful for the time and expertise you shared with us today. A special thank to our moderator for skillfully steering the conversation and making this session both informative and interactive. I invite Dr. Jibin Varghese to kindly present a memento to our skillful moderator, Dr. Lily Poda ma'am. A heartful thank you to the scientific evaluators, Dr. Abhishek Jain sir and also Professor Hemant Bagora sir for your valuable time, excellent work in assessing the paper and poster presentation. Your fair evaluation, constructive feedback and commitment are truly appreciated. Thank you, sir. Now, I would like to take a moment to honor our nation's symbol of pride, the national anthem. May I request all the dignitaries, speakers, chairpersons to stand up in honor of national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
On behalf of organizing team and all participants, I now officially declare this conference is closed. We thank you for your active participation, insightful discussions, and the connections made over the past few years. Safe travels, and we look forward to see you at the future events. Thank you all.